a comprehensive guide and tips for a successful procedure. Coronary angiography and angioplasty are vital procedures in diagnosing and treating heart-related conditions. These procedures have revolutionized the field of cardiology, allowing doctors to visualize blockages in the coronary arteries and restore blood flow to the heart. If you or a loved one is scheduled for a coronary angiography or angioplasty, it is essential to understand the process and be prepared. In this article, we will delve into the details of these procedures and provide you with valuable tips to ensure a smooth and successful experience. Understanding coronary angiography. Coronary angiography, also known as cardiac catheterization, is a diagnostic procedure that allows cardiologists to assess the condition of the coronary arteries. During the procedure, a thin, flexible tube called a catheter is inserted into a blood vessel, usually through the groin or wrist. The catheter is then carefully guided to the heart and a contrast dye is injected, making the blood vessels visible on X-ray images. These images help the cardiologist identify any blockages or narrowing in the coronary arteries, which can indicate the presence of coronary artery disease. The coronary angioplasty procedure. If blockages or significant narrowing are identified during coronary angiography, your doctor may recommend angioplasty. Angioplasty is a minimally invasive procedure that aims to widen the narrowed arteries and improve blood flow to the heart. Here are some key points to keep in mind. Stent placement. During angioplasty, a small balloon attached to the catheter is inflated at the site of the blockage to compress the plaque against the artery walls and widen the artery. In many cases, a stent, a tiny wire mesh tube, is also placed to keep the artery open and prevent re-narrowing. Recovery time. Angioplasty is generally performed on an outpatient basis, meaning you can expect to go home the same day or within 24 hours. However, full recovery may take a few days, during which you should limit physical exertion and follow your doctor's advice regarding medications and lifestyle modifications. Tips for a successful procedure. Clear communication. Ensure you fully understand the procedure, risks, and expected outcomes. Ask your doctor any questions you may have and communicate any allergies, medical conditions, or medications you are taking. Follow pre-procedure instructions. Adhere to the fasting guidelines provided by your doctor to prevent complications during the procedure. Also, follow any medication adjustments or restrictions advised by your healthcare team. Post-procedure care. After the procedure, closely follow the instructions given by your doctor. Take prescribed medications as directed, keep the insertion site clean and dry, and monitor for any signs of infection or abnormal symptoms. Conclusion. Coronary angiography and angioplasty are crucial procedures for diagnosing and treating heart conditions. By understanding the process and following the tips mentioned above, you can approach these procedures with confidence. Remember to maintain open communication with your healthcare team, adhere to pre- and post-procedure instructions, and prioritize your recovery for the best possible outcome. Your active participation and dedication to your health will contribute to a successful and smooth experience during these procedures. For more informative videos, please like, share and subscribe. Thanks for watching.